Welcome to another episode of Adult Sex Education. I'm Dr. Stephen Davidson, your sexual integrity coach located in Wilton Manors, Florida. Today I'm covering part 2 of a 3-part series about sexual shame. Last week I told you how shame was different from guilt. I told you that guilt resulted from regret about a thing you did or didn't do, while shame was a conclusion that you are a bad person, unworthy of love and happiness. I explained how shame can occur individually on a micro level, one person at a time, or it can occur on a macro level collectively when institutions shame entire demographics of people. Either way, there can be lifelong consequences for those who are targets of shame, especially when that shame begins early in life. We're not innately born feeling shame about our bodies or our sexuality. Our sexuality is part of a primal instinct influenced by our genetic composition and the environment we live in. It would be senseless to experience shame about something so inherent as breathing, eating, sleeping, or sex. Through sexual, verbal, physical, or emotional abuse on a micro or macro level, humans learn to experience shame about their bodies and their sexuality. Across history, religions and governments have regulated bodies and sex. Sexuality has been demonized, pathologized, and criminalized as a means to control how bodies experience sexual pleasure and with whom they enjoy it. It is why comprehensive sexuality education is so scarce in most universities and schools in the U.S. The science of human sexuality is inconsistent with traditionalist beliefs and expectations, and therefore access to the information is limited. Consequently, humans learn to hide or lie about their sexual thoughts and desires in an effort to appear compliant with religious and government mandates. Non-compliance throughout history has led to humans being arrested, committed to mental institutions, being exiled from their community, as well as being denied access to housing and employment. In some cases, even public execution as a means to intimidate others that strict compliance was necessary for survival. The consequences of discovery reinforce the shame people experienced, even with their own private thoughts. Sexual shaming leads to many common mental health concerns, such as depression, anxiety, body dysmorphia, addiction, and eating disorders. It can also lead to post-traumatic stress disorder in cases where it included abuse or assault. It is a factor in some sexual disorders like erectile dysfunction, vaginismus, and compulsive sexual behavior disorder. When I began my career as a psychotherapist, I didn't intend to specialize in sex therapy. However, after practicing only a few years, I discovered that many of the patients I worked with had mental health problems resulting from sexual trauma and sexual shame they had experienced early in their life. This motivated me to receive specialized training in sexology, which is a decision that I have never regretted. It's also why I complain so much about physicians, psychologists, and social workers not having some basic sexuality education as a requirement of their core training curriculum. When we've been shamed about our bodies or sexuality, we might try to hide those aspects of ourselves associated with the shame. We may dress in ways that hide those parts of our bodies that were criticized or had attention drawn to them. We might isolate or avoid social situations where we fear others will judge us and shame us again. This can limit our potential for personal growth when we're too fearful to go out into the world and be witnessed by others. We might overcompensate in an area of life that we have no interest in as a way to appear more acceptable to others. We might lie or keep secrets if we believe our personal truth will not be tolerated or could lead to harmful consequences. Our relationships will be superficial and unfulfilling if we are hiding parts of ourselves to accommodate others' expectations. Shame leads to fear of failure. We avoid new endeavors, pursuits of our dreams, going after what we ultimately want, because we fear we will not be perfect and therefore others will judge us and shame us even more. We can't bear our own judgment or self-loathing. If we never try, then we never fail. Ironically, shame also leads to fear of success. What if I do succeed? Others will judge me to be an imposter. They will expect things from me that I can't deliver. They will steal my success by finding even more severe ways to shame me and tear me down. Avoiding success is how we avoid the positive attention from others that we believe we don't deserve, and the negative attention from others that emotionally feels too painful to bear. We disappear, try to fade in with the wallpaper so people will not notice us and therefore leave us alone. My book, Sexual Integrity: Finding the Courage to Be Yourself, was a direct response to the amount of shame that I've witnessed from clients that I've worked with over the last 35 years. Yes, some of them identified as gay, trans, or kinky, but you might be surprised to know that cisgender vanilla straight men and women also carry a lot of shame about their bodies and sexuality. The book contains scenarios of men and women who overcame their shame and reclaimed those parts of themselves they could no longer hide or deny. In the next episode, I will talk about how to overcome shame, take off the mask, and find the courage to be yourself. I hope that you will like this video, share it with a friend, and subscribe to this channel if you haven't already. You'll find links to this book, as well as my second book, Peaceful Mind, Peaceful Life, The Guidebook to Happiness, on my website at sexualintegritycoach.com. Also, both books are available on Amazon, Audible, Kindle, and fine booksellers everywhere.